How you doing? My name is Angel Ortega, and this is my unpacking of mock medical supplies for surgical procedures for 140. And as you can see, I just want to let you know that I'm in the proper surgical attire. I got the cap, the scrubs, shoe coverings. Okay, should we get started? So now what I have here is I'm unpacking my supplies that were separate from the surgical instruments from last week. So I'm just going to kind of walk you through um, everything here. So what we've got here is we've got sutures, we've got a vial, we've got surgical towels. That's a table cover for the back, the mail stand, um, the mail stand cover, and I believe this is a needle counter. We'll dive into that soon, shortly. But what I want to do is now that I have all these here, I kind of want to give you an explanation of what their purposes are in surgery. So let's, I'm going to start with the first one on the list, which is the male extra large male stand cover. So that is this bad boy right here. So a little bit about that. It looks like it has no alias. The uses for it is it drapes large male stands. It features reinforced to help prevent tears. Impervious backing helps prevent strike through contamination. Sorry, making sure keep my computer on. Contamination. A little bit of additional information. It's 30 by 57 inches. Large male stands are often used in orthopedic, neurosurgery, or spine cases. All right, so we're moving on to the next. The next one we have here, this is the back table cover right here. That's a pretty sturdy thing there. So a little bit about that is it has no aliases. Its uses for it drapes instrument tables, back tables. A little bit of the features, it's reinforced for extra tear resistance, impervious backing to prevent fluid strike through. So pretty means like fluid soaking through, I believe. A little bit additional information about this is 44 by 90 inches. This is a pretty big one. So we will move on. Next we have surgical towels here. So obviously you see that this was used in ethylene oxide gas chemical indicator. So it's pretty much meaning like this is the label that goes on to let them know that if it was sterilized or not. So that's a surgical towel. So a little bit about these. It's a woven towel, surgical towels, alias woven towel, cloth towel. Uses it drapes the surgical site, covers mail stand or portions of the back table. Can be rolled to make a place to hold instruments. I think sometimes what they do with surgical towels too is from what I read, I feel like they are I feel like they are like used like to like if they're prepping an abdomen, they'll kind of like cut off the top and the sides and no prep and this and that, just to catch the prep stuff like that. But I want to say, I don't know, maybe the towels are probably counted, but I don't know about these. I mean, I know like we use these, so like obviously it's you can count these. Okay, we got a male cover, a cloth on the stand, and then we got a cloth on the back table. But maybe towels are covered too. I don't know. I have no. I believe so. It's kind of a good question. I should Ask my professor. I mean, I know like cotton and stuff like that, or gauze that was used in surgeries are counted. But anyways, we are moving on. We go to the next. It looks like here we are. We have what we call, it looks like a needle, we call a needle counter. Alias, another nicknames for it. Foam block needle counter. So the uses for this is to hold suture needles, knife blades, and other sharps. So a little bit of the features here is it's numbered foam inserted sticky surfaces on opposite sides for blades. Additional information, putting only one suture needle in each numbered space enables count to be accomplished more efficiently. Some needle counters have metal magnet strips instead of foam blocks to hold the sharp. So I'll show you what I'm talking about. So that's what it kind of looks like in there. So we're starting from the top. So that is blade number 20, then 11 and 15 and 10. So let me give you a little bit of information on these blades, okay? All right, so I've got some stuff on these blades here. So if we um, go, oh smokes, oh, I was in the wrong book. Sorry about that, guys. Sorry, miss. So if we look into the book here, so we'll start from the bottom, which is the number 10 blade. So the number 10 blade, so category it's undercutting and dissecting. And the little description is it is an extensive body blade with a curved edge to the tip. Its uses, it is used for making incisions or skin incisions. A little bit about this is so when you put these in when you put these on the scalpel numbers or the scalpel handles, you'll have to make sure that you use a needle holder to insert these on. Never use fingers to load or unload a knife blade from the handle. Always use a needle holder. That is a very, very good tip. So now let's move on to the center. We have, on the top of the center, we have an 11 blade. That's also cutting, dissecting. A little bit of description of that. It has an angled cutting edge that ascends to the sharp point. Its uses is it is used for puncturing the skin or to initiate the opening of an artery. So, and a little bit about that is the number 11 is commonly loaded onto a number 7 handle. A scalpel blade is a single patient use item that comes packaged and sterilized from the manufacturer. Again, you know, with the number 11 blade, never, ever, ever use your fingers to load this on a scalpel handle. Always use a needle holder because otherwise you will cut your finger. I just want to let you know, too, that that I'll get back to you. I'll find out after. I'm going to go through the rest of these blades and I will let you know what the number 10 blade goes on to. So we'll move on and let's go to the blade below the 11, which is the 15. It's the number 15 blade that is also undercutting and dissecting. It is a narrow blade that has a small rounded cutting edge. Its uses is used for creating a small precise incision. A little bit of the instrument inside is commonly used for pediatric or plastic or reconstructive surgery. A scalpel blade is a single patient use item that comes pre-packaged and sterilized from the manufacturer. So, again, with this one, never, ever, ever, ever use your fingers to load them onto the scalpel. Always a needle holder. So we go into, so then we got, I just want to let everybody know, then we go to the top. Number top is a number 20 blade. So, and just so everybody knows that the number 20 blade is cutting and dissecting. A little bit of description about it. It has a broader body or broader body blade with a curved cutting edge to the tip. The use is it is used with the number 4 handle to create a deeper and or deeper or larger and or deeper incision and on heavy tissues and bone. A little bit of instruments, blades should never be loaded with fingers. Obviously, you know that that's a no-no. So this one, this one, this one, and this one, always a needle holder. Never ever with your fingers. Because if you do that, that is a no-no. Okay, give me 1 second. I'm sorry. I just okay. So now back to what I was telling you is the number 10 here. This one goes on to the number 7 knife handle. So the number 7 knife handle takes up blades number 10, 11, 12, and 15. So this one and this one on a number 7. That one on a number 4. And a number 3 long could also take the 10, the 11, the 15, and the 20 is the number 4 blade. So just so we are clear on that. And then the number 3 knife handle can take the 10, the 15, and the 11. All right, so we can close that up so we know about that. So now we're moving on. We are moving on to sutures. So now here's what we have here. We have a PGA violet braided polyglycolic or polyglycolic acid absorbable suture. So obviously you can tell, like, this is the size of the suture here. And they don't really have a needle on here, but this would tell you like what the needle is. So I'm just going to go on a limb either and say that this is a cutting needle or a taper. But otherwise, this is your needle here. And a little bit about this needle here is this is a PGA suture, and they're commonly used in general surgery, gynecological soft tissue, including ophthalmic procedures. That's what this is kind of used for. Gynecology. That word's just bothering me. Gynecological. There we go. Otherwise, a little bit about this suture is it's made from it's a synthetic absorbable monofilament PGA violet braided polyglycolic absorbable suture. Needle combos are precision braided for pliability, strength, and knot security. It retains at least about 60 to 70% of its tensile strength after 14 days for quality healing. So that is pretty good. So obviously, we know what they used for. So I'm assuming maybe this like for skin closure, maybe a little deeper underneath the skin. So we'll move on. And what we have here is we have 2 other sutures. It looks like they're the same. The only difference is it's non-absorbable suture. And I believe this, like, see, these needles look different. So I'm just going to go on a limb and say that this is like a conventional cutting needle. And this is probably going to maybe be like a tapered needle there. So, anyways, so we've got a monofilament black non-absorbable nylon suture. Size is 3.0. So a little bit about that. Let's see what we got. Okay, so where are we? Sorry. Okay, here we go. So originally this would be like, the name would be like an Ethelon, like that's the people that make it. But the alias is a nylon suture. So pretty much this like kind of like closes skin and uses for closing skin and eye surgery. The features are monofilament nylon fiber. Additional information is available in black, green, or undyed. Available sizes 11.11/0 to 2. So I don't know. I think like so normally with these packs here is they would come in a container with already with needles ready with these sutures on. So I think a little safety tip is when you were getting these ready, you would take the needle holder and you would grasp the needle right away. And then as you pull it out, you would switch it, your hands, and make sure that the surgeon takes it handle side. So that way they can start suturing. All right, so we are moving on. And now this was a little confusing here. So this is a little practical vial, 10 millimeters. A little bit about this. So I'm hoping I kind of got this right, but I think this is a thrombin topical, has no aliases. Its uses is for topical hemostasis, apply only on the surface of bleeding area, often gel foam. Surgifoam is soaked in and applied to bleeding. Features is it comes as a powder, must be mixed with enclosed container of normal saline. Additional information available in 5,000 U or 20,000 U vials or 20,000 U spray kits. Must only be used on topically cannot be injected. So I'm assuming that this is probably going to be an item that's counted to, I'm assuming these, and the surgical blades and the towels. I'm not certain about those because like those are just like guaranteed. Like, okay, we used one male stand cover and then we got a back cover for the table. All right, so now we'll go on to part 3 of the discussion is like now how I feel. Like now that I've seen everything from the instruments last week to the basic supplies that we have here. Do I have any thoughts about them? I have no thoughts. I kind of have like, I'm excited. Like I've always waited to do something else bigger. I feel like the closer I get to these items here, like the more they get closer to me, I feel like I'm like one step closer to actually doing the real thing. Like I'm not really excited about like the towels, surgical towels and like the covers or anything, but I'm more excited about like learning like all these sutures and needles and like, vials and stuff like this or needle counters and stuff like that. I'm just like, I'm just overexcited. To me, I feel like these like they're like halfway. Like were they expected to me? I feel like they're more like halfway. I feel like when it comes time to actually going into the real thing, then that's when my expectations will actually start to get ready. Start just like, oh my God, this is the real deal. But do I feel if I'm ready for that? I am ready. I am 100% ready. I've been waiting for this since I first started this program. I originally came from MATC, started in MATC 2001, just doing gen eds, and now I am like 100% ready. I feel like each time I complete a semester, I get closer and closer and closer to the real deal, and I am beyond excited. You have no idea. I don't really have any questions about the instruments or the stuff. Actually, I do, Mrs. Gray. Hopefully I got this right, but I'm just a little curious on what this was. But other than that, that's the one question I do have for my professor, Mrs. Graham, is what's it like? Like the real thing. Is it like fast paced? Is it like scary? I just want to know that way. I won't be intimidated. I'm just more like I'm just ready for everything. But anyways, that concludes my class, parts 2 and 3 for my presentation. Thank you, and I hope you guys enjoy. Sorry, Mrs. Graham, if the video's too long.